Good evening, class. We are looking at home health care in our in vivo assignment this week. So let us take a look and see. I'm going to share my screen to give you the presentation. There we go, screen share. Google Hangouts. All right, so that's the end of the presentation. Let me look at the top. So we're looking at home health care. So here's the situation. Our grandma just turned 80 years old, and her health is going a little bit downhill. So we're looking at finding her some care to help with activities like bathing, eating, and taking medication. So let's look and see what home health options we have. So some agencies that have nationwide caregiver offices and offices local to grandma, who's in Washington State, are Right at Home, Home Instead, and Gentiva. So let's take a look and see and make a comparison to see what their offerings are. So Right at Home charges $25 an hour. They do have a minimum of 3 hours, or you can pay separately for just a 1-hour bath visit. If grandma is going to require more advanced care later on, then we could look at overnight care for $250 a night, or live-in care for $375 per night. Our second choice is Home Instead, and they, excuse me, I'm sorry. For personal care, they charge $28 an hour. So bathing and helping grandma eat and taking medication would be considered personal care. So they would charge $28 an hour for that. They also have their own version of live-in care, which is $335 a day. And lastly, Gentiva is wholly covered under Medicare. So but they only provide restorative care, which is usually practiced under an occupational therapist, so that the patients receive care by the nurse to be able to get them to bathe safely again on their own using occupational therapy techniques. And lastly, skilled nursing is the lowest level of care that Gentiva offers. So they don't do the eating, the medication aid. Pretty much if it's something that grandma or a relative could do, not a registered nurse, then it's not something that they offer. So let's look at the type of training that the workers who are going into the homes have at each of these agencies. So Right at Home has certified nursing assistants, restorative nurses aides, and home care aides. In the state of Washington, they all have to have certificates in order to work for a home care company. And so all must be trained and certified with the state. At Home Instead, they employ home care aides usually. And so they have to have 25 hours of training with the state. And Home Instead did say that they can employ someone who's not trained initially, but they have to become certified within 200 days. And that became law in the state of Washington in 2012, that they have to have that certification. So they can take online courses to get home health aides, to become home health aides, and they have to recertify for their aid certificate every year. Home Instead is non-medical, so they don't have nurses. They generally just work with people who need help around the house and things of that sort. And lastly, we're looking at Gentiva, and they employ registered nurses. So those that have at least a 2-year degree. Physical therapists and occupational therapists are a graduate degree. Social workers are a bachelor's, speech pathologists are a master's, and home care aides, we looked at those. And they do employ some at Gentiva, but they're strictly for bathing only visits. That's the lowest level of care that they offer. So what kind of payment options do each of these facilities take? We are looking at weekly billings. Right at Home has self-pay or check and credit card. They also contract with the Veterans Affairs, so they would be billing the VA weekly instead of billing you if you were a veteran. And lastly, they do take long-term care policies. This is not the same as regular insurance. We'll be taking a look at what long-term care insurance policies means here in a minute. At Home Instead, You can pay by check or by auto bill pay. They also are approved with the VA, and they also take long-term care policies. And lastly, Gentiva takes Medicare and some Medicare replacement insurances, such as Humana's Medicare Advantage. And this particular Gentiva office I talked to does not take self-pay. So they just choose to work with Medicare as their payer. All right, so let's take a look at the next one. So since a lot of these companies do not take insurance, what kind of things do they take that, or what kind of things can you do to lower the costs coming out of your pocket? So 22 of the 50 of our 50 states in the United States have a tax credit that specifically applies to this type of care. There's also the medical expense tax credit and the elderly and disabled tax credit. So let's take a look and see which states offer the specific tax credit for this type of care. You'll notice that Grandma State, Washington, is not on this list, unfortunately. So most of that's going to be coming out of pocket. They may qualify for the other federal tax credits or different state tax credits that are not that specific dependent care tax credit. So I asked the companies that I researched what percentage of their patients have different payers. And so Right at Home was 80% self-pay, 10% from the VA, and then they also partner with Franciscan Hospice to provide some of their cleaning and cooking and things of that sort care for their patients. Home Instead, 80% are self-pay, 15% are long-term care insurance, and about 5% come from the VA. Now, Home Instead just recently partnered with the VA, so they're expecting that more and more of that percentage is going to go up, that they're going to get more VA patients coming to Home Instead soon. And lastly, Gentiva has 95% of their patients coming from Medicare and 5% from Medicare replacement plans. So after researching these three providers, what choice do we think is good for Grandma? So we looked at price, worker qualifications, and the care that Grandma needs. And it seemed like Right at Home had the lowest out-of-pocket price at $25 an hour for 3 hours of care. And then they also required their employees to be certified prior to beginning employment, so not within 200 days after starting employment. So that protects patients. And when we were looking at Gentiva, it didn't look like Grandma qualified. She's not working with an occupational therapist who is recommended skilled nursing. So that might be an option we can look at is trying to see what kind of occupational therapy Grandma might be able to pursue so that we can get her back on track taking care of herself. But for now, Gentiva doesn't meet the needs of assistance with eating or a medication aid that Grandma needs at the moment. So we chose Right at Home for Grandma. Let's take a look at the next one. So we talked about long-term care insurance before, and so what does that mean? So it's different from traditional insurance. So it's designed to cover long-term services and supports such as personal and care and cleaning your house and things like that. So so it's important to note that this is something that you purchase before you need it. So this is kind of one of those optional things for your insurance. So some of the factors that you'll need to consider when looking at a policy for long-term care, as far as cost, what they consider when taking that into account when they develop your policy is how old you are when you buy the policy, the maximum amount that the policy is going to pay per day for your care, the maximum number of days that the policy will pay for over your lifetime. And then they say that the amount per day times the days determines the lifetime maximum that the policy will pay. And then you can choose additional benefits like your benefits increasing with inflation. And we've learned in some of our other classes that inflation is around 3% per year is average for our national inflation. So costs for home health from the time that you purchase your insurance policy to the time you need it are going to increase 3% per year from the time that you purchase it. So that's something to definitely consider. Now, it does say that if you're already in poor health, you may not qualify for long-term care insurance. So that's something to look at ahead of time. But also, there are some few insurance policies out there that will take you on if you are already needing long-term care, but you're going to be paying usually a lot higher rates for that. So take that into consideration. Other definitions we look at are what is a Medicare approved home care. So Medicare Parts A and B cover part-time, intermittent, skilled nursing care through an approved agency like Gentiva. So they also cover physical therapy, occupational therapy, speech therapy, home health aid services, only those specific ones like bathing, medical social services, durable medical equipment, medical supplies, and other services. And you have to meet certain criteria for Medicare to cover that. Now, skilled care, the type that Medicare offers, is a type of care given when you need rehabilitation staff. And so those are the nurses that are teaching you how to bathe yourself again. These are the physical therapists that are making a plan for you to get back on track to where you can do all of those activities of daily living yourself again. So what successes did I have during this project? When I started calling around to these different agencies, they were pretty forthcoming with all information and questions that I have. And many of them went above and beyond to tell me the ins and outs of their business and the industry and where to look for something that would suit grandma's needs if they didn't offer it. Difficulties that I had, it was difficult to find a company who accepted insurance as a payer. So only home health agencies that offered skilled nursing like Gentiva took Medicare, but they didn't take any other insurance. But skilled nursing didn't do the activities of daily living that grandma would need. So that was something difficult that I came across. So as we're going to look in a second at healthcare executives. So that's something that that healthcare executives can consider is it profitable for your business to take on home health as something that you offer. So the advice that I would give to somebody who is looking at home health care as an option for themselves or a loved one is to look and see if your insurance plan while you're younger offers long-term care as a separate policy, and who their approved providers are, who is providing the care for you, or who do they accept. And I did want to mention that Veterans Affairs, provides care for that. So if your loved one or you are a veteran, that's of a huge benefit to you. But most of this is coming out of pocket, so that's something that you have to take into account long before you're going to need it, because of the high cost of it. You're paying at least $75 per day for this care. Now, I did find that even though insurance companies didn't accept it, there were a few that said, we partner with this agency who will give you a discount because you have our insurance. So like I looked at Anthem Blue Cross Blue Shield, and they listed Healthcare Plus as someone who gives you a discount on your home health care if you are a Blue Cross Blue Shield member. Also, if you are part of an HMO, some of them have their own home health divisions within their healthcare system. So that's something to look at, is if your HMO has a home health division, that might be cheaper than trying to find someone on the outside. And lastly, if you've ever worked in a doctor's office, you know that some of them have paid lunches where representatives from various agencies come and talk to you. Sometimes they're home health agencies. Now, doctors usually can't prescribe basic home health, but they can refer you to a specific agency if you mention you would like to explore home health options. So you need to make sure that you do your own research, making sure that whatever agencies that they refer you to are a good fit for you, because they could be influenced by, you know, listening to their spiel over their paid lunch about the services that they offer. So just make sure that you are choosing one that's right for you, that you're doing your own research. Now, future healthcare executives, it's good for you to know that, you know, as an executive, you're going to be determined whether or not it's going to be profitable for your insurance company to offer long-term healthcare insurance policies, and at what age or mobility level would you need to charge more for those policies. Also, would you require insurees to pass an extensive physical exam by their physician to qualify for that extra insurance? Home health is only going to be becoming more and more needed as we have more of the baby boomer generation retiring. Another thing to consider is that home health is one of the fastest and most profitable franchises in the country at the moment. So in fact, 3 of the top 10 best franchises in America by Forbes magazine were home health agencies. And these were Bright Star Care, Right at Home, and Synergy Home Care. They all made the top 10 list for best franchises in America. So that's something also to consider if you're, you know, planning on owning your own healthcare agency or something of that sort, that you can consider home care as an option for you. And lastly, I just wanted to share the links with you for the home care options that we considered for grandma, so that you have those. And that is it. Thank you so much for listening to my presentation. And y'all have a good week, and good luck with your in vivo presentations this semester. Bye-bye.